toxins are also going to create oxidative stress in the body. Oxidative stress is anything that your body has to like fix that releases reactive oxygen species. And there's just so many things. Even emotional stress can cause that. Over 90% of the population has been exposed to Epstein-Barr virus. Mold can make your immune system forget what it's seen before. For a lot of the toughest cases that I saw, like when I first was in clinic, the only thing that helped chronic fatigue was sauna.
All right, today I have Dr. Kasey Holland here, and she is a fellow licensed naturopathic doctor. She just moved to Alaska, and in her practice, she mostly sees people with chronic stealth infections. So we're talking about Lyme, Epstein-Barr virus, and also mold, which is getting more and more attention nowadays in the media, and how it can really be one of these true root causes when it comes to your health issues. So Dr. Holland, I'm so glad that we're able to do this talk, and thank you for making time. Give my audience a little intro into you, what your background is, and how you got so passionate about Epstein-Barr virus and all these different chronic stealth infections.
Yeah, thanks for having me, Tyler. This is really exciting, and I just really appreciate your presence for people in health and our profession. Well, I had mono when I was really young, and I kind of, I missed 3 months of school. It was really severe. And then it was just kind of, okay, you're fine, keep going. I don't think I ever realized how much it was impacting my life. I think it really impacted my ability to study and focus, which I'm realizing now that I'm healed more of, wow, I was really struggling during school. But what really led me to figure it all out was actually my last year at Bastyr University. I started seeing patients in clinic rounds like you're going to be doing, which was really awesome. And I had so many people that were having similar symptoms to me. And the only thing that showed up was, EBV. And then I was in Seattle, which we'll talk about mold a little bit later, but it's a very moldy area. So I think that also kind of coincides. And then when I moved to my residency, I was exposed to mold in a home I was living in, and I got really sick. And so then I really dove into what's happening with Epstein-Barr virus, why some people get it once, have mono, and are okay, and then why other people have these chronic symptoms that can range anywhere from debilitating fatigue and brain fog to joint pain and even more intense neurological symptoms. So that's how it all started.
Awesome. Thank you for sharing that. And okay, so when I was in college, we heard that it was like, mono, which I guess is the same thing as EBV, like you're really fatigued, you're out for months, and you just don't have energy, and it's like a kissing disease that can be acquired. So EBV and mono, is that interchangeable? And I was just told that it's like you get it, and then it's like after that period of 3 to 6 months, like you're fine. Like the virus is over, you get your energy back. So is the virus actually sticking around? Can you talk a little bit more about, I guess, that reactivation that you were mentioning about EBV?
Yeah, so mono, the kissing disease, is from Epstein-Barr virus, and Epstein-Barr virus is part of the herpes viral family. So that means that it's never, once you have it in your body forever. But typically what happens is your immune system puts it into a latent state. So the virus goes to sleep after you get it, your antibodies respond, and you feel crummy for a while, but it's kind of like a normal virus that just has a longer duration, and then you're better. But what we see happening with Epstein-Barr virus is that it reactivates a lot. And so do other herpes family viruses, like cold sores. When you're stressed, you get them. So that's kind of what we see there now. The virus likes to hang out in mucous membranes and whatnot. So that's why the saliva, the kissing disease, whatnot. So usually we call it mono that first time that you get it. And usually when you go to the doctor, what they're going to do is a mono spot, which is it's just a little blood prick. They can do it on your finger, and they're looking at the IgM antibodies. Okay. And in the conventional medical community, and medical community across the board, that's typically what what we thought, and that's all we had to worry about. And they would tell you rest, like, take a nap every day, get fluids, that type of thing. You might need to withdraw from school. I think we all know people that had to take a break from what they were doing because of it, and then you would be better. And like, I still remember the doctor saying, that's kind of it. There's a rare chance it can reactivate, but that doesn't happen, blah, 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 blah. But what we're seeing is that it is reactivating. And I think a lot of awareness obviously has come out about this because of Medical Medium and his book showing that, he is saying, hey, this virus turns back on. And so now we have people that are going to their doctor and saying, I think this virus is back on. Thankfully, we do have very good blood panels that can help us see if it is reactivated, but there's gray area in that too, because we have to remember that we have an immune system that is responding to this virus, and it has a timeline, and it's fluid, right? Like, our immune system is doing different things from day to day. So sometimes those results can be confusing based on what your immune system is doing. So let's see. There was another question that you threw in there.
Yeah. So I guess with EBV, it's being integrated into our cells. It's hiding out in the mucous membranes. Is it hanging out in the nervous tissue as well? I know with some of those herpesviruses, they will hang out there. Is that like the ganglion?
Yeah. So we have some research kind of showing really that it likes that vagus nerve too, which another thing to think about it with the vagus nerve is, our gut, obviously. So I think more things are traveling on that vagus nerve than we think about, like LPS and endotoxins from bacteria in our gut. But it can hang out in nerves, and we do see like ringing in the ears and things like that sometimes associated with EBV. Now, that's not just with EBV. You can have that from low thyroid and other things as well. But we do see a neuro picture. We also see people having neuroinflammation and things like that, really contributing to the brain fog. And usually it's those more chronic cases where it's in the nerves and whatnot. So that's where when it's reactivated, it's becoming more systemic. And that's the big thing, is like, well, what causes that reactivation?
Yeah. So can you speak a little bit about that as well? In naturopathic medicine, we're always talking about the terrain. And so your body is responding, and there's this dynamic relationship between our external environment and then that internal terrain. And we kind of also talk about this like total toxic burden or total toxic load. And part of that load of this metaphorical rain barrel is kind of this viral load. So the herpes virus families, and do you have mold or do you have Lyme? And so can you talk a little bit about, like, what are those factors that maybe make someone more susceptible to a recurrent infection? Or, are we thinking about the immune system being weakened? Can you speak a little bit to that?
Yeah, so
a lot of questions.
When I look at Epstein-Barr virus and I look at the research, I did find one article that was talking about different transcription factors it has. And they were trying to look at what makes it more likely for the virus to turn back on. Mm-hmm. And I think it gets really confusing because for some people it's stress, for some people it's a car accident, for some people it's mold, for some people it's Lyme, for some people it's poor gastrointestinal health. So what do all those have in common? And when we look at that, what I see that they all have in common is that they can all cause oxidative stress in the body. Mm-hmm. And I think that the virus is smart enough, it has these factors, so it kind of senses when there's definitely signals going off in the body that virus is picking up to know that it's a good time to turn back on. And so then you have the virus reactivating when other things are going on. And then we see this big picture. Now you're talking about toxins and toxic load. So I love the bucket analogy of, from birth, we have this health bucket, and even before we're born, there's stuff in it from our parents. Like it's just how it is. So when people are talking about, well, I wasn't sick until I was like 30 though, I still want to know what happened when you were 5 and what you were eating, because we keep putting things in the bucket, it fills up, and then it's overflowing. And that's when we usually have symptoms and we're looking for what's going on. We may not know that we were setting up that environment, but whether it is a car accident or mold or whatever, we've pushed that tipping point. The virus senses that it's a good time to replicate, so it starts replicating again. And then the virus likes B cells, so that's really where it hangs out. Now, there are different strains of the virus, so some of the more aggressive strains can be found in T cells and NK cells, but that's less common. What we typically see is the B cells. And then, so that's why the virus is called a self-infection, is because of how it lays low, because of how it knows when to turn back on, because of how it's hijacking the body's own immune system, which then you have all these symptoms. And I think is what we see is we blame it all on EBV now, especially now that we have more information that EBV does this and it's affecting people. But a lot of those symptoms can be from other things, like what we're talking about with the mold or gastrointestinal health or immunity, and toxin load, because toxins are also going to create oxidative stress in the body. Oxidative stress is anything that your body has to like fix that releases reactive oxygen species. And there's just so many things. Even emotional stress can cause that. So that's why it can be so confusing as to, well, what caused this? And sometimes we never know exactly, because usually it's a whole array of things.
So it's multifactorial, and it's all these different factors that is basically inviting that latent Epstein-Barr virus to become reactivated and to rear its head. So with people, like, what are the symptoms like? Are they very similar? So when someone is first diagnosed with mono versus a reactivated infection, are people typically seeing the same symptoms? Is this something like they're just noticing antibodies that have been elevated in a reactive infection? And do you think a lot of Epstein-Barr virus has been is underdiagnosed in general?
Yeah. So the mono symptoms are like what we were talking about, where you're really tired, a lot of headaches, sore throat, you may have swollen tonsils, you may have a low-grade fever, and it's almost like the flu that just keeps going, that's kind of mild. So a lot of people have been exposed to that and don't know it. And it is a herpes family virus, which herpes viruses are just like, you're going to get exposed to them in life. Over 90% of the population has been exposed to Epstein-Barr virus. So that's another thing that we have to always think about, where when somebody's sick with it, and it's so scary, but it's like, yeah, but there's a lot of people that have come into contact with it and aren't having those symptoms. So when it reactivates and becomes more chronic, now some people will have just a single reactivation after, say, like a car accident, and maybe they were in really good health and then they have a setback and they come and then they're fine. For more chronic things where we have underlying immune or mold exposure, toxin exposures that are more long-term, then we see really chronic symptoms happening, like debilitating fatigue, joint pain, anxiety from the neuroinflammation. We can see digestive upset too, depending on where the virus is hanging out, if it's affecting your nerves or if it's in biofilms in your gut. And we can see, a lot of times people talk about flare-ups. So we see sometimes you might all of a sudden have those flu-like symptoms again as well when the virus is more active. So then symptoms get really wide, broad, and if you go on a Facebook group, it's like, oh, twitching, like everything can be caused by it. And it's linked to a lot of things. So then that's when it gets really complicated.
Got it. So would you say most people though, like it's being underdiagnosed in the medical community? Like, do people, because some people I feel like they say like, I've never been diagnosed with mono, but maybe there is this monotype picture, or maybe it's just more of like looking at total terrain in general and multifactorial approaches.
Yeah, I think in general that that we don't really test it. I don't think, in conventional medical world, we have a standard of care of what you do when somebody presents with symptoms, and this is what you check for. And it hasn't really transferred that checking for EBV being reactivated and running a whole panel is on that list yet. So So a lot of people with these symptoms are not being tested for it.
You keep bringing up mold. And so, yes, I'm in the Pacific Northwest as well. So I totally understand. It's very moist. It's more humid. I mean, it's very damp. It rains up here a lot, more frequently than I would like. But so mold, every time I'm in clinic now too, I'm always suspicious of mold. There's definitely been people that have presented, and it's very clear cut, like there's definitely an environmental factor to this, and that maybe it could be mold. What makes somebody, I mean, I'm sure there's a genetic predisposition to being susceptible to mold, but what makes it like that relationship between Epstein-Barr and mold, and maybe even Lyme, you've mentioned that. What would make somebody more susceptible if maybe they've had that gene, but it just hasn't been, they haven't been experiencing symptoms until it's kind of like everything comes together?
Yeah, so 1 in 4 people can have an HLA-DR variant that makes them more susceptible to mold illness. But everybody can be burdened if they are breathing in mycotoxins or mold spores. So with mold, it kind of hits EBV it kind of makes EBV able to flourish in like 3 different ways. First off, mold causes severe oxidative stress. I mean, it's like inflaming your brain, it's backing up your liver, causing your liver to do all of this, which sometimes EBV likes to hang out in the liver. So it's this huge burden. It's also, depending on what species, can be very immunosuppressive. So we have mold. I mean, we make mold. Penicillin is made out of mold. Things like that are immunosuppressive. So your immune system goes down the drain. But the really kicker with mold is that, and I learned this through Dr. Jill Krista and her experience with mold. She talks about how mold can make your immune system forget what it's seen before. So it affects your B cells. So then you have this virus that you've already been exposed to that's in your body for good, and it can't remember that it's seen it before. So you don't have that immune response that's ready to take care of it. So then you're kind of just chronically dealing with it. So that's the big reason that mold across the board makes you really susceptible to Epstein-Barr virus.
Interesting. So it almost sounds like a loss of tolerance and the inability to kill autoreactive antibodies, I guess, or this dysregulation where your body can't actually recognize self from non-self. And so it sounds like too, it makes somebody more susceptible for that reason to maybe autoimmune disease. Is there a picture with that?
Yeah, so there is a lot of new research out there that has made everybody so scared of Epstein-Barr virus because they're linking it to autoimmune conditions and cancers. It's linked to 7 autoimmune conditions right now, including multiple sclerosis. And then we also have it linked to, I mean, I swear, like every day there's a new, we found this virus active with this cancer. So I think that has caused a huge wave of fear. And we have to ask the question, did the virus cause that condition? Or was it that the body was already headed that way and then the virus contributed? So there's no doubt about it that Epstein-Barr virus does have proteins that it turns on that are like fire on inflammation and those pathways that lead to autoimmune conditions, cancers. So we don't want it running around like crazy. But
one quick thing, is that only during the reactive phase or even when it's in this latent phase?
So that's only during the reactive phase. When it's latent, it's not actively replicating, and so those proteins aren't turned on. As far as we know so far by research. It could change, but no, I don't think so. So when that happens, what else is going on? I'm kind of more scared of the glyphosate that I probably have been, or the glyphosate, I always say it wrong, that I've been exposed to when I wasn't gluten-free. Than this virus, and that could be also contributing to the Epstein-Barr virus reactivating, because we know it causes oxidative stress. It is linked to lymphoma, so is EBV. So EBV, it turns on, but it turned on because everything was chaotic in your body. So it's not just the virus causing those. We want to address the virus, but we also want to look at everything else that's in your bucket. If it's a car accident, if it's mold, if it's how you're eating, toxins, things like that.
Yeah, so it's always important to address that total terrain and look at that total toxic load on the body,
Yeah.
how we can support that, which I know naturopathic medicine, we are equipped with all these modalities. We're trained in clinical nutrition, we have hydrotherapy,
Mhm.
homeopathy, physical medicine, herbal botanical medicine, which I love. But we also have all these other tools that we can integrate that we aren't, taught in school to really support the body, support the terrain. Can you speak, you talked about oxidative stress a lot and it just being these reactive oxygen species that can cause tissue damage and inflammation. You mentioned like the Epstein-Barr virus, mold, diet. What are some other things that people may not be aware of that are causing oxidative stress maybe on a daily basis? And so if someone's thinking, how can I lower the amount of, reactive oxygen species, what are some of those things to look out for?
Yeah, so also just mental emotional stress, and whether you're in a parasympathetic state where your body knows you're safe or you're stressed, because when you're stressed, you're sending different signals out to your body that can affect your hormones. Um, if you have estrogen dominance and you're breaking it down through a pathway, estrogen gets broken down through three different pathways. There can be one that is more um, oxidative and actually linked to cancers as well. So hormone imbalance, food, we talked about toxin exposure. So, all the buzz about glyphosate and how that's affecting things. If you have a car accident, that's like a big, think if you have a car accident and that stress that is on your brain and your pituitary, which is located right up here,
Mhm.
and you have mold, it's like a huge attack on your brain. So, and then also viruses themselves can cause oxidative stress. So that's where it kind of feeds back in. And the thing with oxidative stress is that when we're exposed to it, is what can happen is, well, it changes our methylation patterns. So methylation and our genes are there, but they can change. And so then it weakens our system to be able to get rid of those toxins and process them. And then also just, how you eat your food and how you digest it, and whether or not you have enough stomach acid. Are you digesting your food and able to use it, or is it turning into something where you're not digesting it well and you're not using the nutrients, and so you're not having regular bowel movements, so you're not getting those toxins out of your body. There's heavy metals like mercury, things like that.
Mm.
um, yeah, the list goes.
So there's so many things. So
Yeah.
you were talking about like over 90% of the population is exposed to
Hmm.
Epstein-Barr virus, but it sounds like the concern is when it's becoming reactivated, and so it's all these different factors that we have to consider. So if someone has a reactivated infection and they are having a flare, how is this treated differently compared to mono initially? And maybe you can speak to conventionally how it is, or maybe it's just dismissed versus like how you would approach this from a more naturopathic functional medicine based perspective.
Yeah. Yeah. So conventionally, if it's an acute viral infection, they're probably just going to tell you to go home and rest, get lots of fluids, maybe take a break from your work. They might throw in like vitamin C, things like that. Naturopathically, whoa, acute mono, we have like all the herbs, like elderberry, echinacea, lomatium, the list goes on and on. Olive leaf, we can use all of those. And then we also have knowledge about pathways that the virus is turning on, so we can use anti-inflammatory things. I really like andrographis acutely because it is seen to be, it's anti a lot of things, not just viral, but then it also helps support our inflammatory pathways. So we have that. We have constitutional hydrotherapy where we can get your immune cells moving around. We have targeted foods. We can coach you on how to increase your garlic intake and things like that, and teas if you want to be taking a tincture or pills. We have all of that. And acutely, it's pretty like straightforward if it's just your first time. And homeopathy, different doctors, they always say if you put 10 NDs in the room and give them the same case, they're all going to have different
Yeah.
ideas. So we can make something very specific to the person and how their symptoms are presenting. Conventionally, with it being reactivated, it depends on your doctor if they're able to, if they are educated and know to run a panel and see that it's reactivated. If they see that, then they may use antivirals like acyclovir or some brand of that. There's a lot of different brands, off brands of that. And that's usually their go-to for that. In the functional medicine world, in my world, I think that we have to really look at what caused this reactivation. Is it a single thing? Like, did you just go through something really stressful or have a car accident? Or has this been building up over time? And we really need to reassess your entire health so that we can protect you from this happening again over the course of your life, so you're not dealing with chronic diseases. So then from there, you know, we always start with food. You're the master of that. So plant-based and getting those detox pathways moving and looking for food sensitivities, things like that, doing an elimination diet, huge. So you're going to feel better when you do that. If you've been eating gluten in the standard American diet, hands down, you're going to feel better.
Have you seen directly a correlation between gluten and reactivation of EBV in the literature?
I haven't seen that in the literature specifically, but I also haven't quite looked for that specifically.
Sure.
So we could look for that.
That'd be interesting. Yeah.
Yeah.
You know, a lot of people have issues with gluten, and I'm always seeing different links with, you know, going gluten-free. And, you know, I think it is different for every person. I think also their gut microbiome is also going to, you know, based on that train, going to make each person more susceptible or less susceptible as well.
Well, there is a direct link to it increasing your zonulin levels, which shows that it causes intestinal permeability, which if you have intestinal permeability, you're basically increasing your endotoxin load, and that's going to inadvertently affect the EBV. So I'm sure it might not be as direct, but I'm sure, I mean, there is a connection there.
For those that don't know, zonulin is kind of like this, the gatekeeper of the tight junctions that hold the enterocytes together, which is the single layer of cells that line our digestive tract. And when you have higher amounts of zonulin, it means that they become unzippered and kind of popped open. So now you have this breach in gastrointestinal integrity, and then some of those undigested proteins and bacteria can then seep in, and the underlying immune system is then reacting with it. So that's what Dr. Holland's talking about when she's talking about increased intestinal permeability and being kind of that gateway to more of this systemic chronic inflammation that needs to be addressed when we talk about health. So very much patient-centered care. We have a lot that we can pull from. You talked about diet. It sounds like it's very antioxidant rich, kind of this anti-inflammatory diet, elimination diet. So very specific to you and removing any of those food triggers that could be eliciting a pro-inflammatory response. With a lot of those herbs you mentioned, are those directly like antiviral, anti-inflammatory, promoting immunostasis? What are kind of those actions of some of those herbs that you like to use?
Yeah, so I like to pick herbs that are, so if we're in a chronic state, then I don't start right away with antiviral action, because sometimes when you use that, you can kind of have a Herxheimer response, or what you really need is to decrease your inflammation to get you feeling better. So I usually start with what we just talked about with the food and the elimination, castor oil packs to get things moving with your liver, over your liver, decrease inflammation. Are you having regular bowel movements? We need that to be happening. And then decreasing inflammation. So there's two pathways when it comes to cancer that EBV can really affect. It's the JAK-STAT pathway and then the NF-kappa B pathway. So the JAK-STAT pathway, the biggest hitter there is using resveratrol. Then we have to look at what form of resveratrol to use, because some of it is fermented when they use it. So if you're a moldy, we don't want to use fermented resveratrol. And then curcumin is huge. I like the Mariva form because it's highly absorbable. A lot of times we have gastrointestinal things going on too. That makes it more systemic, and that's going to help with the NF-kappa B. A lot of times that can calm down brain fog, can calm down joint pain, so that we can get you in a place where then when we pull into antivirals like the herbs that we were talking about and we're doing a killing phase, you're not having a flare up and you're not non-functional for work. You know, we have people that have gone on disability and can't go to work, can't take care of their kids. So it depends on where the person's at and where we start, as always. But we want to get you functional and able to lead up your life before all that. So I see people just start killing. And I always say, it's like you're taking a spray bottle to a huge fire. Like we have to, or like you're pouring, there's still gasoline being poured on that fire and you're coming in with a spray bottle. So we have to get rid of the gasoline that's being poured before we start fighting the fire. So that's really important.
Mm-hmm. So you're killing, but there sounds like there needs to be this ability for you to actually get rid of some of these metabolites from the virus. You talked about supporting the liver with castor oil packs. You talked about having daily bowel movements. And so it made me think about kind of the emunctories, these organs of excretion that we learn about in naturopathic medicine. Is it important to be supporting and opening up those detox pathways?
It's huge. And sauna and EBV are a must, because there's also something about how you're just raising your internal body temperature, and it helps you break that kind of just low grade fever, and you're actually kind of mimicking a fever, which really helps. For a lot of the toughest cases that I saw, like when I first was in clinic, the only thing that helped chronic fatigue was sauna. So part of it is just your core body temperature rising. We always think of sauna with its sweating and like getting out toxins, but it's also shunting blood to different places. So if after you get out of the sauna, you take a 10 seconds of cool shower, that causes your blood to constrict and go back out, and we're moving immune cells. So which, if you think about it, people that are dealing with this chronic fatigue picture with EBV are very stagnant. We don't feel like exercising because we're exhausted. So how are we moving our lymph? So sauna and then hitting that shower and changing the temperature can help us also just get things moving. So that's huge. And also the heat shock proteins that it turns on is going to help prevent things. So that's a major must. And then if we are dealing with more of a toxin load, then of course the sweating is going to help with also removing some of those toxins.
Amazing. Do you recommend like an infrared sauna versus a dry sauna versus a steam sauna? I know everyone has different favorites. Do they all do the same? What have you seen work?
So a lot of times people don't have access to an infrared, and so I say go with the dry sauna. And if you don't have access to a dry sauna, then you can do a hot Epsom salt bath, or you can use peat moss. I'm sure you guys do those where you're at in the clinic. That can be really helpful. The infrared sauna is great because it is getting deeper into your tissues and is more effective at turning on heat shock proteins. But not a wet sauna. I just really, with the mold, I feel like it cooks bugs and then you're breathing that in. So yeah, not a wet sauna, but I think the infrared sauna can have more benefit with how deep it's getting into the tissues and where the virus is and all of that. But if you don't have that, then a dry sauna is great too.
Awesome. And is it imperative that everybody, like you're taking a shower and using soap and water after to like cleanse yourself, or?
Yeah. I mean, think about it. There's toxins coming out of there. And if they have the chance to dry, they could go back into your skin, right? Because they're sitting there, but also you could breathe them in, and then it's just a cycle. So we want to get rid of that as quickly as we can.
So we're supporting the body, we're supporting the terrain, we're giving the body what it needs. Someone is going through this reactive phase. How long, I mean, I'm sure it's going to be different for every person, but like how long would somebody expect to be kind of going through this flare on this type of protocol where they're kind of really supporting the body, like you've been mentioning? Is it a couple weeks? Is it months? What does that timetable look like?
Do you mean the flare-up or the full reactivation?
Full reactivation.
Yeah, so that's really tough. If mold is involved, it's usually a lot longer. And so the labs, a lot of times people will start to feel better, but the antibodies haven't changed. So then people get really discouraged. And I try to emphasize that we can't look at just the labs, because your immune system starts to make patterns, and we have so much to learn about immunology. So if you're feeling better and your labs don't quite show that, you should see the early antigen go down. That's usually only positive for 3 to 6 months. But then is what people see is the titers, like their viral capsid antigen IgG and the other IgGs stay elevated. And that's where a lot of the gray area and the what's actually happening goes on. So sometimes you don't see those come down right away. But it's like that with Hashimoto's too, where you start to feel better, but your TPO antibodies haven't come down yet. So we don't have a good handle on antibodies yet. So sometimes you might feel a lot better, but your labs don't show that. And then you feel like, oh, I still have it. But that can be where you just still do have a high viral load. It can also be the other way, where if you're still feeling awful and the early antigen has gone down, does it really mean that that virus isn't actively replicating? Or is it just doing that because that's the timeline of your immune system? So that's where it gets really, really tricky. And that's where we have to listen to our patient. And are you feeling better or are you not? And listen to their body. Because if they're able to work out again and not have post-exertional malaise or fatigue, then I'm pretty confident that we're getting somewhere. I would say it's probably a minimum of 3 to 6 months, and it can take years, depending on what's going on. If there's mold involved, mold can make it take a lot longer.
Yeah, there's such a big picture with the mold that you keep bringing up. And with mold, how do we know it's more of the mold picture versus the Epstein-Barr when someone is coming and presenting with these symptoms?
So mold has quite the constellation of symptoms, and when you start to see lots of mold, you can pick it out. But if you're having where you wake up in the middle of the night and you have to urinate, if you're having frequency, urgency in urination, that can be a sign. Or if you're waking up in the middle of the night feeling panicked and the mold is in your home, it's actually your body being like, hey, I don't want to breathe this in, wake up, get out. The brain fog with mold is usually more severe and more debilitating than the EBV. And usually also with mold, we'll see really severe, like coarse hair or coarse hair falling out. And this often gets mistaken for low thyroid conventionally. But when you start to have all those pictures together, we also see a lot of neurological symptoms with mold. A lot of, like, you can't find the word that you want to say. I remember when I was exposed, finishing a chart note was like I literally can't do it. And mold, so to check if you're having those symptoms, my favorite resource, go to Dr. Jill Krista's website. She has a quiz. You can take it, see what the likelihood of your symptoms are. If it's highly likely, you can go to Dr. Shoemaker, and he has a VCS screen. It's checking your vision accommodation, and it's all online. It costs, I think it's $10 to $12, and it's not diagnostic, but it tells you a lot if your optic nerve is being affected by mold, which mold hangs out in the sinuses right here. So the pituitary and optic nerve and vision are affected a lot. So you can do that. And then if you score really high on that and you're pretty confident, then you can do a mycotoxins urine test, and that will help us figure out which species are there. Then you can start talking about, where is the mold coming from? Is it from work, school, home? So that's kind of the trajectory there that I start with mold.
It sounds like it's a lot more cost effective too, because I would think of just jumping to the organic acids test or like an ERMI test or something like that, which would be more intensive and, cost prohibitory, I think, for some people. But that's great. I'll make sure to link that for this video so people can check out that resource. Good. And so you also talked about at one point, so Epstein-Barr virus is a virus, and then we also have mold, which is a little bit different. It's not a virus, it's a type of fungi. And then you also talked about Lyme. So these three, I've heard you say, are frenemies before. So with this constellation of pictures, it may not just be one, but kind of all of these kind of working and orchestrating together. Are antibiotics ever warranted in this kind of thing, or in this type of case? And how does that play a role with Lyme? Can you speak to that?
Yeah, so Lyme is going to be a spirochete infection, and a lot of times we'll see EBV reactivate from Lyme because of how so it's really hard on your immune cells. Lyme will take your immune cells, your natural killer cells. And your natural killer cells are immune cells that also really fight against viruses. So we
So they're
see a
good
connection there. Yeah, yeah. So if somebody has Lyme, it's a lot more likely that they'll also be dealing with Epstein-Barr virus reactivation and other co-infections. Now, antibiotics can be useful at times in Lyme, especially if you're in an acute phase. That's a discussion, that you can decide with your doctor. With chronic Lyme, we see them be not effective and tear up the gastrointestinal health and weaken immunity. But if you just have the mold and EBV and you don't have Lyme, then antibiotics aren't really going to work. There may be times, like say with mold, I guess another thing, so I talked about like the constellation of symptoms, but another thing with mold is just sinus congestion and upper respiratory infections. So it could, if you have an upper respiratory infection and the mold makes you immunocompromised, which makes you more susceptible to things like pneumonia or long-term. So you might have to use antibiotics warranted during that phase with your doctor if we're reaching that point. But when it comes to killing the EBV or the mold, antibiotics aren't going to work. Sometimes we do use pharmaceutical antivirals or antifungals, depending on what's going on. But the antibiotics aren't going to work in those cases.
Okay, good to know. So it sounds like for each person, though, it's really coming back to this foundational approach. What I think, and it's this naturopathic approach where we're kind of pulling from all these tools and kind of assessing that terrain. But I think it makes it difficult for a lot of people because a lot of maybe their conventional doctor or their doctor that they have access to, because I know not everybody has access to a functional medicine or naturopathic doctor.
Yeah.
It's really just kind of palliating those symptoms and supporting them, but it's not really looking at those root causes that may be causing more of this oxidative stress picture that you were talking about. And so for those that maybe don't have access to that doctor, what are some of those tips that you would give to somebody who is struggling and like where to even start? Because maybe this information is amazing to them, but they're overwhelmed because they're like, I think it could be so many things. So like, where do I start? Because I think there's that overwhelmment and then people don't take action because of that.
Yeah, so start with removing things that could be adding to your bucket. So really dial in on your diet. I mean, follow functional foods and dial in on your diet.
What are some of those foods though? Can you just a little bit like that people should be focusing on?
So anything from the brassica family is going to help support your liver. So broccoli, cauliflower, all of that. Olive oil can also be a nice add-in where you're adding in garlic and onions. I add garlic and onions to everything that I cook, even breakfast. And that's going to also help support your healthy gastrointestinal flora. As many leafy greens as you can get, because that's a prebiotic for your good bugs. Their kale and okra can be binders for mold. So increasing those can be really good. And then those are like my favorites. I'm trying to think. I guess eat the rainbow. So your bioflavonoids are really important for getting rid of toxins and pulling things out. So, like your red peppers and things like that, the colorful guys, your carrots, all of that. That's why, starting the morning with a green smoothie is honestly really, really easy and fast and works well. Grab that instead of your breakfast sandwich that has gluten and cheese on the way from Starbucks. It's cheaper too. So that kind of thing, like really just incorporating vegetables as much as possible. If you are in a flare-up and feeling really awful, then Byler's broth can be really helpful. And it has, there's different variations of it. Dr. Jill Krista references it in her book, but basically it's, I typically add cauliflower to it. So it's kind of like a cauliflower creamy soup with bone broth and garlic and onions and kale, and you can kind of add what you want in there. But I have those things to help, because when we decrease the amount of foods that we're reacting to and we have something really easily digestible like that, everything kind of calms down. So to get people out of flares, I use that a lot. So yeah, those are kind of some of the big food things that I like.
So it sounds like a really nutrient-dense whole foods diet that incorporates a lot of color, a lot of fiber, a lot of phytochemicals and antioxidants, and really focusing on that brassica family that is going to support our liver detox pathways.
Yes.
Yes. Good. Okay. Good. I mean, have you seen though, like people having, you talked about digestibility, like gut-based issues, or maybe having issues with FODMAP, so then maybe they would not be able to do as well with some of these cruciferous vegetables or in the allium family, like the garlic and onion, because I could see that posing a challenge.
Yeah, so SIBO and Epstein-Barr virus go hand in hand. So if you have SIBO going on, then that can be really difficult. And then you have the low FODMAP as well, which when that happens, I highly encourage people to be working with a nutritionist or naturopathic doctor or somebody, because it really does get difficult to be getting the nutrients that you want when you're also struggling with vegetables and things like that.
So if you're removing a lot of these disturbing factors and that are kind of contributing to this oxidative load on the body, but you're also just really ramping up and focusing on your nutrition, can you heal your Epstein-Barr virus from nutrition alone, or does it really take this multifactorial approach?
So I think that some people can heal from nutrition alone, and some people feel so much better when they make those changes. If we have heavy metals or mold or other infections, or a nervous system with the pituitary and adrenal and thyroid axis that is off, and hormone imbalances, if it's gotten to where it's really chronic, then we probably also will need to address those things. If there's biofilms in the gut, which is a whole other topic, then it's going to be really hard to heal it with nutrition. It can make it a lot better, and it's foundational to moving forward for sure. But I don't want people to just get back to making it through their day and surviving. Yeah. I want people to feel really good. And to get back to that point, you probably are going to need some more targeted interventions.
Yeah, I agree with you. And when we talk about healing, I just want to clarify. So it's putting that virus back and getting out of a flare and getting back to this latent state, because you're always going to have that virus. And so it's just a matter of fact, is it replicating? Yeah. Is that right?
Exactly.
Awesome. And there was one thing that that you said that really brought something that I wanted to ask. Okay.
No pressure.
No, it had to do with that healing aspect. I mean, I was curious too earlier when you were talking about homeopathy. Have you seen homeopathy work really well with your patients? Do you utilize it a lot too? I know some people love homeopathy. It's like not their favorite tool, but it's always great to kind of have, different modalities in your toolkit to treat patients.
It works well with the mental emotional picture for me. I think that's where I am able to identify most, but there's some doctors that are more skilled at using it for like, oh, this symptom and that symptom. For me, I use it a lot for the mental emotional picture and that anxiety, things like that. Or sometimes there's different forms of homeopathy. So sometimes it can be really helpful for detox with people that are, take a supplement and they have crazy symptoms. No matter how little of the supplement they take, they're super sensitive. That's also something that happens a lot with mold. And so using homeopathy and really just focusing on gentle things like having them get a lymphatic massage or something like that, or do rebounding to start to move that, where we actually need to be doing that before we're doing anything new orally. That's typically when it really helps.
I remember what I was going to say. Biofilm. For my audience, and for those that don't know what biofilms are, can you just briefly describe what those are and why we would want to target biofilms?
So bugs are smart, and bacteria, and we see now that that Candida also will create a biofilm. It's basically like this sticky matrix that they put around themselves to hide themselves from the immune system, from antibiotics, antivirals. There's a study where Candida biofilm had herpes viruses in it, and then the antivirals were less effective against the herpes virus. So when you then think, okay, Epstein-Barr virus is a herpes family virus, then if we're having candida overgrowth in the gastrointestinal tract, which is really common just due to standard American diet and what we are exposed to, then you might be taking all these antivirals and doing really great, but you have this underlying biofilm that's there. And so you're never quite getting to all of it.
So it sounds like having some of these interventions, maybe they're nutraceuticals, maybe they're herbs, that targeting biofilms is just as important as part of that whole protocol along with the antivirals, or can you do it just on antivirals alone?
You can do it just on antivirals, depending on like if you don't have a biofilm.
Yeah.
But from what I've seen, that even if you do get better for a while, that it's more likely that you'll come back and be reactivated if we didn't deal with those.
What are some of your favorite nutraceuticals and or herbs that we have to kind of help disrupt some of those biofilms?
Yeah, so I love liquid biocidin.
Okay.
The reason I like it is because, so not the liposomal, the liquid. Liposomal can be useful too, but the liquid is actually for the gastrointestinal tract more and localized there. And it's antifungal, antimicrobial, somewhat antiparasitic. So I really like it though, because what you can do is it's liquid, so you can start with just a little bit. Some of these that are capsules, you take one and people have a huge reaction and don't feel well. So I like just starting drop by the liquid biocidin and getting a good idea of how reactive somebody is. And then we can be like, okay, we're going to use this and this because your O test is showing this bacteria and we know you have candida, so we're going to rotate. So I rotate through a lot of things, but I like to start with the liquid biocidin because it's drop by drop and we can prevent you from having a really awful flare up.
Awesome. I love that we have so many tools in our toolkit and to really, meet our patient where you're at, which you talked about before, which I think is so important because every person is at a different place in their healing journey. And I know there's also resistance sometimes. I mean, not everybody is really ready to truly heal. And it's kind of moving away from that paradigm where there's just this one pill for every, ailment, where it's really taking a systematic and integrative approach to really treating that person there in front of you and addressing those root causes. The last thing I wanted to ask you is for those that have watched this, they're inspired to kind of like tackle their Epstein-Barr virus from a more integrative perspective, but they are still a little skeptical. What advice would you give, or maybe it's something from your experience too, that you wish you had that knowledge or you're more aware of this that would have helped you get to this state of more optimal health quicker? What maybe kind of one of those obstacles that you've seen?
Yeah, I would say to stop minimizing your symptoms and trust yourself, because when I look back at what I went through, there were times where I said, I'm just not motivated. What's wrong with me? Like, I need to get it together. What's wrong with me? And I just blamed myself instead of being like, hey, there's something not right here, because I am a motivated person. And if I felt good, I wouldn't be not having energy to do this or to do that. So stop saying like, I think in women's hormones, it's really common, like, oh, well, I have that, but it's normal. But it's happening more with fatigue too, where it's normal to be busy. It's normal to be exhausted. So stop normalizing it and trust yourself and really think about the last time that you felt really great. Like 10 out of 10, I'm ready to go climb a mountain today. And for most of us, it's like, oh gosh, like when I was 5 or when I was in high school. And you start to realize, and you're like, wow, this has been going on for a long time. We just get used to not feeling well. So really start to connect with yourself and your full potential and miss that, because you've gotten used to not feeling well. And then when you realize that, then you remember your full potential and you know that there's something else going on and it's not just within you or within your head.
Yeah, I love that. I mean, you know you best. So it's important to advocate on behalf of yourself.
Definitely.
Well, thank you, Dr. Holland. This has been a great conversation. You're a wealth of knowledge. For those that want more information on Epstein-Barr virus and kind of how this all interacts And to connect with you, where can they find you?
Yep, they can go to drkaseyholland.com. We're in the works of making as much available as we can. I'll be doing EBV Awareness Month again this year in April. And there are some courses available for those that are interested in more of a handheld approach and meal plans, things like that. So yeah, you can start there, and I will be working on this more because I know that people need it and that it needs to get out there.
Awesome. Well, thank you so much for all that you do. Your work does not go unnoticed.
Oh, thank you, Tyler. Thank you for your work too. Holy moly.
I would love to come visit in Alaska sometime soon.
Oh yeah, anytime. So. Yep, I'll take you to dog sledding. We'll do all sorts of stuff.
Nature up there too.
Awesome.
So, all right. Well, thank you, and have a great rest of your day.
You too.